Hello, and welcome to the County Health Rankings and Roadmaps 101 webinar with a tour of our website. My name is Mary Bennett, and I'm a community coach with the County Health Rankings and Roadmaps, and I'm joined by my colleague, Kate Conkle.
Hi, everybody. Great to be here.
As we go through this webinar presentation, we'll be taking turns answering your questions, as well as sending out links via the chat box. And slides for today's webinar, you should have received the link to that, so you can see that now or at another time. First, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps is a collaboration between Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. This program is the result, just as with y'all, the contributions of many partners, and the ones here are the ones we would like to highlight. Next, we want to take a moment and get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, where you can see our screen throughout the presentation. On the right, you can see the control panel. Here, you won't find the handouts for today's session, but you will find it via the link that we just sent. What's most important is that you can also interact with us through the control panel by using the question section. Please feel free to ask questions or share your thoughts and experience with us via the control panel throughout our webinar today. We'll be sure to leave time for your questions. You'll also see that we've made this an open webinar so that people can see others' names and follow up individually if someone asks a question you're particularly interested in. So we'll be covering today the overview of County Health Rankings and Roadmaps. Kate will be leading us in a live web tour. We'll be sharing a lot of tools and resources, and as we said, question and answers. So our guiding question today is, how can County Health Rankings and Roadmaps help you build a culture of health? So Robert Wood Johnson Foundation has laid out a powerful vision for building a culture of health in every community in the country. And this vision includes individuals and families, and that they should all have the means and the opportunity to make choices that lead to healthy lifestyles regardless of where you live. Not long ago, America viewed health as the doctor's office. Maybe many of you can relate to that, as an isolated from daily life. But today, we know better, and research gives us a better understanding of how interconnected health is with income, education, housing, and a myriad of other factors. There is a tremendous need to shift from the old lens of working in silos, as we are finally finding only a cross-sector approach can fully address these intertwined and complex issues. Each one of us are a piece of the puzzle of building a culture of health. The hope and vision of a culture of health has to be shared. The circle of engagement needs to extend to the whole community. The truth is, everyone has a stake in the health of the community, from families, schools, businesses, to rich and poor. In this same way, the County Health Rankings and Roadmaps programs is made up of many components that work together with a common purpose to build a culture of health county by county. As we share the various components today, that make up county health rankings and roadmaps, we invite you to think about what piece or pieces of the program can you use. This picture shows the thinking behind the rankings, our theory of change about how rankings can be a catalyst for action that improves the health of the community. Starting at the left, you see population-based data is collected by others, and we utilize this data, to create an easy-to-use snapshot that compares county within states and is released every spring, just released this last March 16th. But we produce the rankings for a reason, because they get the attention of media and can be used to start and broaden conversations about health in communities. Those conversations can then lead to broad community engagement and multi-sector partnerships that can in turn select and implement evidence-informed strategies to address community priority areas and finally, ultimately, to improve health outcomes. So essentially, the county health rankings aren't about the numbers, they're about a call to action. And we also know that while simple in theory, that putting this model into practice is challenging. And so we provide tools to assist communities in each area, and we'll talk more about those. But first, we're going to start with the rankings. The County Health Rankings ranks the health of nearly every county in every state. For each county, you will find 2 rankings, and this is really important to get clear on this framework. One is for health outcomes, that's in green throughout our site, which reflects your county's current health, or what we call today's health. And one for health factors in blue, which reflects how healthy a county might be in the future based on the many factors that influence health, or as we call it, tomorrow's health. And this image is one of the most important images we'll share with you today, because it shows that what we use to determine the county health rankings and roadmaps, I have something coming, and what influences health in a community. This model shows the important relationship between policy, health factors, and health outcomes. The rankings make it clear that good health includes many factors beyond medical care, including housing, education, jobs, access to healthy food, and more. It shows us that all these factors impact how well and how long we live. Starting from the bottom, we know from the research that effective state and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors shape our community's health outcomes. We specifically look at the health factors in the darker blue, health behaviors, clinical care, social and economic factors, and the physical environment. We measure, as I said, 2 types of health outcomes in the green boxes to show how healthy each county is, the length of life and the quality of life. As an example, expanding early childhood education improves academic achievement. Higher levels of education lead to higher levels of income, which then influence other factors such as access to healthy food, clinical care, and quality housing, which again, in turn, influences health outcomes. So stepping back, you'll note that we don't include race or ethnicity in our health factors. we've selected health factors that reflect aspects that communities can improve. Race and ethnicity are not modifiable, while poverty is something we can take action on. So you will see income is a key health factor. We do provide data, tools, and resources that can help communities address health disparities, and we'll show you later where to find these on our site. If we're going to build a culture of health in every community, reducing health disparity really needs to be a top priority, because everyone in our society deserves an equal opportunity to pursue a healthier life. Kate will be doing a web tour in a few minutes, as I said, and she'll show you more about the rankings, how to find your snapshot of health data for your county, and how to utilize the data. Now we'll continue on the overview, and next stop is roadmaps, the how-to of rankings and roadmaps. Here's a screenshot of our newly updated Action Center. Here you'll find a variety of valuable tools and guidance to support your work and assist communities to take action. The Take Action cycle and all its resources provide a step-by-step guide. Communities can and are improving health by using the steps of the cycle, assessing needs and resources, focusing on what's important, choosing effective policies and programs, acting on what's important, and of course, being sure to evaluate those actions. There are a wealth of tools and resources to access in every step of the way, from methods to selecting priorities, to strategies that have worked in other communities, to, for example, sample action plans. All of this is intended to support your work in your community. At the heart of the Take Action cycle is people working together, because we know, and I'm sure you know, that solving issues like childhood obesity, poor high school graduation rates, or crime and recidivism require the wisdom and resources of everyone in the community. Building a culture of health involves helping everyone realize they have a stake in improving health, and all sectors, as those reflected in the center of the action cycle, have a role to play in improving a community's health. You'll also see that work together and communicate encircle the action cycle, as it is important to continually communicate with partners, policymakers, your community, and also know how to use the media to effectively tell your story. So there are 5 foundations of roadmaps, and they include, as I've said, it takes everyone, all of us working together to improve health, and we need to move as quickly as possible from data to action, not get stuck in analysis paralysis or drowning in data. We encourage communities to look to the evidence to inform these actions, and of course, if you innovate, be sure to evaluate. So keep focus across health factors, including the important social and economic factors. And it's important to prioritize your efforts to focus on creating better opportunities for health of all community members, especially those who aren't as healthy as others. And of course, don't be afraid to take on policy, systems, and environmental change, which will in the long run create the greatest long-term change in health for the children and adults in your community. So I want to point out, and Kate will share more about this, but What Works for Health is a wonderful resource, and it provides an easy-to-use, searchable menu to help you look for evidence-informed policies and programs for the specific problem or challenge you're addressing. It includes evidence ratings, literature summaries, and implementation resources for almost 400 strategies. You simply select a health factor of interest and then browse through the evidence ratings for strategies that address the particular health factor you're interested. So you'll know what is effective, and you can accomplish the outcomes that you are seeking. So as we say, evidence does really matter, because when it comes to developing and implementing solutions to problems that affect our communities, using what's been shown to work can really drive smart investments. None of us have a lot of time, money, or resources, so choosing strategies that have been shown to work can help stretch the impact of scarce dollars and resources. Knowing whether there are strategies that effectively address your community's priorities can help inform decisions about when to adopt existing strategies and when to take more innovative approaches. It's important to understand what has been shown to work and what hasn't when creating new solutions. Explicitly considering what works can help to ensure that your innovative solutions are effective. I'd also like to point out to you that we have community coaches such as myself and Kate, and there are 11 coaches across the country who can provide consultation, link you to resources, and help build your capacity to improve the health of your community. And the really great news is that because of the support of the Robert Wood Johnson Foundation, this is at no cost to you. So you might wonder, well, what does this support include? So it can be possibly coalition building tips, or the sharing of an effective assessment tool, or functioning as a guide on the side to support selecting priorities and implementing policies and programs. One of our coaching team participants said, on our monthly calls, our coach focuses on bringing us together and keeping us moving forward. She asks excellent questions that help us arrive at answers and make progress. Our coach is not only a public health content expert, but is also very skilled in leadership and methods of collaboration. All the skills she brings and links to resources on our calls are invaluable to our team. So again, the coaching program offers community leaders the opportunity to strengthen and rejuvenate multi-sector partnerships so they're better poised to advance work that builds a culture of health, enhance your community capacity, build direction, alignment, and commitment to implement and sustain specific strategies, and connect with other community leaders or national experts who are tackling similar challenges and have things to share that can help in your efforts to build a culture of health. So you've heard all this, but you might think, well, why invest time in coaching? So here it's highlighting that it can build your confidence in your efforts. It can keep you more strategically focused, help with accountability on goals and actions, and build the strength of your capacity as either a coalition or a community group, and develop a level of local capacity to really create change and have a learning improvement, and also to perform innovative programs. So now that you've had this overview, and I know it's lots of words, and I hope that it's clear for you, but that you've had the overview for the rankings and roadmaps, I'm really pleased to turn it over to my wonderful colleague, Kate Conkle, and she'll lead us on a virtual tour of the website so you can be more familiar and be able to find the resources, again, that support your work in improving health.
Alrighty, thank you, Mary. So hopefully you're all seeing my screen right now with the home page of County Health Rankings and Roadmaps, which is countyhealthrankings.org for those of you who haven't visited yet. So what I want to do today is walk through some of the updates we made to the website this year so you know where to find things. There are some changes, and then really just walk through how as a community you might use the tools and resources found on the website to work with community partners to improve health. So we're going to start again with this homepage, and starting with just this top orange navigation bar. You'll see a couple of tabs there, some of them the same, some of them have changed. So we'll start with our Health Rankings tab, and under this tab you'll find more about our approach, that's the model, and some information about that. You'll find some tools that we'll return to a bit later, including using the rankings data and measuring progress. You can also download the data from this tab. Right next door, we see the Roadmaps to Health tab. So this is that second part of the project that Mary talked about. Here you'll find the Action Center. You'll find some information about the Roadmaps to Health coaching as well as what works for health, the link to that page. And then if you're interested in learning more about what other communities are doing to improve health, we've got some stories and also some information about our national partners. The Resources tab is new this year, and under this tab you will find reports including the key findings reports from the past 3 years as well as your health gaps reports. This is also where you'll now find tools and resources, webinars, and FAQs, all really good and important resources for you to have. And then finally, under our More tab, you'll find our county by county blog. You'll also see the RWJF Culture of Health Prize information has moved here with the link to that page, and then the About tab just has more about our team, our projects. You'll find some publications there, so just lots of more deeper information about the project. And then of course our search tool. So if at any point when you're on the website and you want to come back to this home page, you can click this County Health Rankings and Roadmaps logo at the top left, and it will bring you right back to this home page. If you're kind of lost and you're searching for things, you can just come right back to the beginning. Otherwise, on the page you see our map, our standard there. You can go to your snapshot through the map, or you can also come down here and search your community in the Find Your Community search box. I do just want to scroll down to the bottom. You'll also see ways to get into stories, the blog, and know what we're doing on social media and Twitter as well down towards the bottom. But let's come back up to the map because we're going to go into a snapshot first and explore our data. So again, you could put your county name into or your state into the Find Your Community box. I'm going to actually click on the map so we can see what the state landing page looks like. And today I am going to go to Alabama. This is where I went to graduate school, so I'm going to give a little shout out to the South. Spent a couple years there, so to Alabama we go. So you'll see on each state landing page we've got two maps, one that looks at health factors and one that looks at for the health outcomes, and I kind of reversed those. So health outcomes is going to be green, health factors is blue. And then as we scroll down, I want to show you, and I scrolled over that map, so now you can see you can make those maps bigger or smaller if you need to. But scrolling down on this page, we also have links to your state health gaps report. Great information on how you can start to close some of the gaps in your state, disparities between different groups. We've also got links to finding more data. You can access the Action Center through this page as well. There's more downloads and data resources. We've got specific resources for your community or for your state connected to community health improvement. And we've got state contacts listed for each of the 50 states. These are people in your state that we work with to help get information out to local communities. And they can be a helpful resource if you've got some more state-specific information that you'd like to connect about. But for now, that health factors map just keeps getting a little bit weirder as I scroll over it. So we're going to close out of this now. We're actually going to go into a county. And again, I went to school in Birmingham, which sits in Jefferson County. So we're going to click on Jefferson County, Alabama. All right, so we come in here and we see our county snapshot. Over here, you'll see the list of counties in the state and how they ranked. And then we see the information for Jefferson County specifically. Across the top, there's ways to get into, explore the measures. You can download some different, your snapshot, some data, different information, so you can go into there. You can compare counties, so if you want to see how you do and see next to another county how you're doing, you can compare counties. This year we do allow you to compare across state lines if that's of interest to you. And you can do that from here. You do have to first select your state and then select your county, but hopefully that little bit of extra work is okay for the added feature of being able to compare yourself with a county in a different state. So now let's actually look at our snapshot and what we'll find in that and how we might better understand and explore it. So the first thing to note, as Mary pointed out, every county actually gets two different ranks, actually has several different ranks, but two primary ranks, one for health outcomes and one for health factors. So you'll see that Jefferson County here ranks 28th when we think about health outcomes, that's length of life and quality of life, and ranks 3 for health factors. So quite a difference there. And it's not unusual to see that. These are based on different values, different measures. And what that might say to a community, although certainly more discussion would be needed, is that things are going okay now, 28 out of 67, so middle of the pack there, but doing much better in health factors. And those are the things that we think about as driving health in the future, or impacting health down the road. So that might be a good sign that things are going to turn around and are starting to improve or have been improving or will improve. So for each of these different factor areas, we look at different measures, and those are these areas in blue, these words in blue. So maybe, as we look at adult smoking, we say, well, what are we talking about when we say adult smoking, or any of these measures? And you can scroll over that measure and it will tell you what we actually mean by that. So for adult smoking, we're talking about the percentage of adults who are current smokers. We'll click into a measure detail page in a bit to see how you can get even more information about that measure, but let's first look at the data. So for each of the measures, we provide county level data. You'll see your county value in that this one is for Jefferson County. And so we look and it says Jefferson County, the adult smoking is at 17%. So we want to say, well, what does that mean? How are we doing? So we can come over to this last column and compare that to our state data. And for Alabama, the average there is 21%. So great, we're doing a bit better than the state average. That's something to be happy about. And now maybe we say, so we're doing better than the state average. How do we compare to those U.S. top performers? That's this second to last column here. And they're at 14%. Now it's important to note this is not the national average. This is the best performers in the U.S., so the top 10%, the 10th percentile or 90th percentile, depending on the factor. So we see doing better than the state, not quite as good as those U.S. top performers. So maybe this is an area where we'd want to do a little bit more work. Something to talk about. And you can do that and sort of look through that information for each of those counties, or for each of those measures, sorry, for your county. You'll also see that for some of our measures, we have trend graphs. So instead of having just one number and being able to say this is how we do at this particular point in time compared to the state and those top performers, we can look how we compare over time. So I'm going to click on our trend graph for adult obesity. And here again, you'll see you'll have the trend graph for your county, that's in blue, for your state, that's in green, and for the U.S., and that's in orange. So you can see what you look like compared to and over time, the U.S. and national. And then again, this is an average for the U.S. These aren't the top performers. So for adult obesity, we see, we're sort of following the same general trend as the state and the U.S., although they're flattening out a little bit faster than we are in Jefferson County. So again, maybe just something to talk about as a community and looking through those different trend graphs to see if your trend looks similar, different, if you're trending in a totally different direction or at a faster or slower pace than the rest of your state or the U.S. as a whole, and if you're going in the direction you want to go in. And the little cheat sheet for that is if your trend graph is red, that means your number is trending in the wrong direction. If it's yellow, that means it's staying about the same over time for the time period that we have. And if it's green, that means it's getting better. So that's, as we scroll down, we can see you can look through the data, look through clinical care. We have social and economic factors, remembering that these are the factors that we really know have the most impact on health, and so really want to pay particular attention to those. And then the other thing I want to point out before we go into the measure detail pages, I'm trying to scroll slowly so I don't make you guys sick. You'll notice for a couple of our measures we have those two little asterisks next to them, and I want to point out as we scroll to the bottom, we have our fine print. So again, we have that mark that when the 10th or 90th percentile, that's the information for the U.S. top performers. For some counties, you might have blank values. You might not have data for everything, and that's to reflect that we have unreliable or missing data. This is almost always going to be very small counties with very small populations. And then finally, those measures with the double asterisks. This data should not be compared with prior years because there's been some changes in definitions and methodology. And so we have a few of those this year. You can learn more about those changes a few ways. One, you can come right into that measure, and here's the measure detail page I was telling you about. For each of our measures, we have this. You can look at the data. You can click into the description that will tell you the reason we rank, some of the strengths and limitations of that measure. This will also tell you, go to the data source tab for more information about the calculation changes that occurred with that measure this year. And in the data source tab, we have more specific information about that. We've also got some great information in the FAQs. Again, they're up under the resources tab on the changes, particularly to the behavioral risk factor surveillance survey data. And we've got a webinar on some of the new changes that you've seen or that occurred, new measures and some of the changes for 2016. So there is a webinar archived. It was from February with our data lead Amanda Jovag. Great resources to learn more about some of those. The last thing I want to point out with the snapshot, actually two more things, sorry, is that one, our additional measures are actually much easier to access now. And they sit right under each of those factor areas. So under health behaviors, you'll see we have additional health behavior measures. You just click on the plus sign and you can go right into those. This year, you'll see that we added two measures here, one on drug overdose deaths that's modeled and one on insufficient sleep. We've added a few other additional measures, one in social and economic factors on residential segregation. You'll see that down here under social and economic factors under additional social and economic factors. So some really great additional data for you. We don't use that data to provide the ranking, but we know that it's important to add additional information and context for communities to think about. Finally, the last thing with your measures or with your snapshot is at the top we have these areas to explore and areas of strength. We've generally provided the areas to explore. We added areas of strength this year, so you can click on these. I'm going to click on them both. You'll see one is orange and one is purple, and as we scroll down through it will highlight areas that you may want to consider exploring further and some areas where you're doing well compared to others in your state or across the U.S. Using some different formulas that our data team has developed. So this can be a really good tool and just a quick way to see how are things going in our community and where do we maybe want to find more data. So that brings us to, if you want to explore a factor or a measure or a specific area in a bit more detail, how might you do that? One of the tools we have on our website is up under that Health Rankings tab, and it's the using the rankings data. So we'll pop into that quickly. Under here, you'll see we've got some tools that help you think about how to explore and understand the data provided in your snapshot. We also provide some tools to help you think about digging deeper. What are some questions you might want to ask, excuse me, to think about how you may want to explore this data in a different way to understand not just what's happening in your county, but within your county. And how are different populations or neighborhoods in your community impacted differently by these different measures that we think about. You can broaden your view. We know that the measures we provide are a starting point, but there's certainly other information to consider when doing work in your community, so we give you some ideas of what else you might consider. And then finding more data. So if we go into this, you can see we've got state-specific data sources. So you can click into your state and it will take you to some information and it will let you know at what level you're able to access that data. The other tool I want to point out that I think can be particularly helpful is measuring progress. This really helps you understand how you can use the rankings as a tool and the ranks themselves as a tool and how you shouldn't use them as well, and how else you can measure progress in your community over time. So really the call out here is that ranks, while they're great at getting attention and we want you to use that opportunity to call people to action in your community, that they really aren't the best measure for measuring progress over time. And the data within your county snapshot, as well as information you're collecting in your own community and in your county, can be much better at actually showing you how you're performing over time. So this is a really nice tool to help you think about that and move on to thinking about evaluating and how to use this information. All right, so we've looked at our snapshot, we've started to explore some of our data. Now we're ready to actually say, what can we do? So we're going to go into the Action Center. Again, that's under the Roadmaps tab. And Mary pointed out that at the heart of our Action Center is this Take Action cycle. And in the Action Center, we have guides connected to each of those action steps that are in the action cycle, as well as guides for each of the partners that we find at the center. So you can click on a guide for a partner or for an action step. If you're maybe not quite sure what you'll find in there, you can scroll over the action steps and it will ask you a few questions and you can say, yep, those are questions we're thinking about and asking. Maybe this is the guide we need to be in. So we'll go into a guide so you can see what they look like. We're going to go into Work Together. This is the guide because we're always all in work together, so it applies to everybody. So when we go into Work Together, you'll see all our guides are organized with a brief overview of what it is, the purpose of the guide or of the step, who to involve, and then each one is broken down into key activities. So different activities that you would undertake during that process or during that step to move this forward in your community. Work Together actually got a little bit of an update this year. We added this first key activity, Work Together to address health inequities, really trying to focus on and call out to communities that it's really important to make sure that everybody in the community, especially those with the least opportunity for good health, have an opportunity to live a long and healthy life. So if we click into a key activity, you'll see that we've got the guidance available there. We'll just scroll down. This is a long one. Some of them are really short, like a paragraph or two. Some of them are a bit longer. It depends. And then we've got suggested tools to help you with that step. So this one has a lot. If you ever see that we'll always list 5 here. If it says view all tools with this arrow, you can click on the arrow and view more tools. So yeah, this is what each of these steps look like. You'll see lots of places, you've probably seen it already, this Get Help button. If you're in a step or you're working through the Action Center and you can't find something that you're looking for, or you're not even sure what to look for, you can always click that Get Help button. It'll send an email to our staff here and someone will get back to you, will connect with you and work with you to find what you're looking for, answer the question that you have. From here, say, you know, oops, I don't want to be in Work Together. I want to be in a different guide. You can scroll through here and find what guide you'd like to be in. Maybe you want to go check out Act on What's Important. This was our other guide that got an update this year, and it will take you there. So that's the Action Center. There's a lot there. We know there's a lot there. We hope that it's a really rich resource for communities, but please let us know if you need help finding information in there. If you already found a tool or resource, or you know what tool or resource you're looking for because someone sent it to you, and you don't remember where in the Action Center it is, you can always come up to resources and go into tools and resources. You can search for it, you can sort it by type over here, and you can actually find tools and resources there as well. If you say, I don't really remember quite where it was in the Action Center and you don't want to click through all of those action steps, those key activities, you can always come into tools and resources. So I'm going to quickly take us to one tool that's very popular and that we love sharing with communities, and that's What Works for Health. And Mary mentioned that earlier. So again, under the Roadmaps to Health tab, you'll find it's there. It's also in the Choose step, the Choose Effective Policies and Programs. So if you're working in that step, you'll find additional guidance in how to pick the best policy or program that works for your community. But What Works for Health is a searchable database of over 350 strategies. And it's a great starting point for thinking about what you might want to do, what strategies and solutions you might want to consider for your community. We do have a 4-minute tutorial on how to work through this particular tool. You'll see over here on the right, we do update this on a monthly basis. We add new strategies, and we also update policies and programs that are already in here to make sure that we are still providing the most up-to-date information available. You'll see on the left-hand side here we've got a toolbar, a menu bar that will give you some more information about our ratings and methods, and if you just want more information about this part of the site, there's lots of great information there. And then you'll see that each of our strategies are connected to those different factor areas that we have in the model. So I'm going to click into diet and exercise today because it's a topic that I think many communities are working on, and so one that hopefully will resonate with you. So you'll see under diet and exercise, we've got 73 results. Again, this is in part because of the robust work that's going on around the U.S. Not all strategies have as many, but we certainly have listings under each. So 73 results, that can feel like a lot to have to look through. So on the left here, we have different ways that you can sort these different strategies. One is by approach. So we know that there's lots of ways to impact diet and exercise. You can increase access to healthy foods. You can create opportunities for active living. You can promote approaches to increasing broad approaches to increasing physical activity. So we've got all of these different ways to impact diet and exercise. I'm going to click on this first one, increase access to healthy food. And you'll see we've got 26 results for that. You'll see the listing, you'll see a brief description. These were all updated, so hopefully it's an easier description for you to better understand what that strategy actually is, and it has the evidence rating. So Community Gardens has some evidence connected to it. We'll take a look at what that means in a moment. Community Kitchens for Food Processing is an expert opinion, and Community Kitchens for Nutrition Education has insufficient evidence. So we've got a whole mix right here in this first one. But let's click into Community Gardens and see what one of these listings actually looks like. So we give you the brief overview and talk about the expected beneficial outcomes, other potential beneficial outcomes. We know that sometimes we impact things that the program wasn't actually intended to impact, but it still has some effect. We list the evidence of effectiveness. We talk about whether or not it's likely to have an impact on disparities, and we provide implementation examples and implementation resources. So this is really a pretty robust listing here. And you'll also see, if you scroll all the way to the bottom, if you're working in this area, we also will link to related policies and programs. So ones that are similar. Maybe you say Community Garden's not quite what we're looking for, but we want to go down that path in some way. So you can actually look and see what else is related to that particular strategy and learn more about those. You'll also see under this one we have a community in action. And this actually, we'll click into it. This is about Atlanta places of worship grow gardens in their yards. So this will give you some information about how communities are actually implementing this particular strategy, or how a particular community is implementing the strategy. We also have some of these communities in action located throughout the Action Center and specific key activities that will tell you more about how the community is using a specific tool or working through that particular key activity. So look for those throughout. They can be great, great ways to inspire the rest of your community and just learn more about what's actually happening in communities around these different areas. So I think that's all I have for the tour. I'm going to hand things back to Mary to finish out some slides, and then we'll take some questions.
All right. Well, thank you so much, Kate. I hope that you feel you've benefited from the tour, and it helps to get an image of what you're looking for so that when you do it on your own, you already have some familiarity. So our next question is really one that some of you are chatting about to us, and maybe some of you are asking your own minds of like, what action can we take to create health for all? How can we assure that our work is creating health for all sorts different people? And how does one work with a health equity lens? And what does health equity really mean within the context of building a culture of health? So Kate's going to be chatting out some resources as I talk about this area. Is my screen shared? I believe it is. Yeah. I'm hoping that all of you can see my screen now. I'm going to just double check since Kate mentioned it. I believe you are. So a culture of health is where everyone in a community has equal opportunity to good health. In other words, health equity. Health equity includes a shared commitment to identifying and addressing gaps, an opportunity that tends to disproportionately and negatively affect certain populations. Health equity is a basic principle that all people, despite race, ethnicity, limited English skills, gender, age, religion, income, educational level, all of these areas or ability have equal opportunity to lead healthy lives. It also means creating a sense of community where all individuals, especially those most affected by poor health outcomes, feel they have a voice and a role to play in creating and implementing solutions. Healthy People 2020 states, achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address unavoidable inequities, historical and contemporary injustices, and the elimination of health and health care disparities. So let's take a moment to break this down with some examples of policies that have led to some of the current inequities. So in thinking about housing, access to affordable housing is key to health. And generations ago, during President Franklin Roosevelt's New Deal, the federal government started subsidizing a lot of housing. But they were funded programs that allowed whites to move into new suburbs like Leventon, New York, while the option for black people was public housing apartments in the same city centers where they already lived. And over generations, the suburban homes greatly increased in value, creating wealth for the white families there. Meanwhile, even though laws have changed, allowing African Americans to have the right to buy places like in Levittown, many of these homes are now really out of the range for many people. Another example is the wage gap between women and men, with a history of women being excluded in the workplace and women's jobs being differently valued than men's. There's a long-standing income disparities between men and women. And here you see this example for 2011, and we know that women still make only 79 cents for every dollar men earn. Although the gap varies considerably across occupations, overall women earn less than men, and this has a significant impact on families, especially working single mothers, but also two-parent families depending on a woman's wages are also affected. So as you reflect on your work, we invite you to consider how you might work with those who are most vulnerable to identify what changes are needed to improve health outcomes in their communities and help them find the data and solutions they need to make their case to policymakers. I also encourage you to check out the links that Kate is sharing with the Health Gaps report and also the RWJ, Robert Wood Johnson Foundation site, which has information, tools, and inspiring stories on how to truly address health equity. Now, before we wrap this up and turn to questions, I'd also like to highlight the Robert Wood Johnson Foundation Culture of Health Prize, which honors communities whose efforts illustrate an enduring commitment toward creating a culture of health for all residents. Winning communities receive $25,000 cash prize and have their success stories celebrated and shared broadly to inspire locally driven change across the nation. The 6 criteria displayed here on the slide drive the selection of prize winners. So these are important to look at and think about how you can bring these alive in your community. These are the prize communities for 2013, 14, and 15. And I really encourage you to, quote, meet our winning communities and learn about their accomplishments on our website by going to the home page and clicking on the Robert Wood Johnson Culture of Health Prize, then clicking on past winners, because there the videos are really inspiring about the work of each community. And as you can see, there are parts of the U.S. that aren't represented, and we sincerely encourage applications from across the country. So moving forward, I'd like to focus on what we call the 4 Ds. And that one is investigate the differences. Use digging deeper and other data tools to understand differences between subgroups. Focus on the drivers that most influence health, policies, systems, and environmental conditions that create opportunities to improve health for all. And dig deep into the root causes, why all the health factors affect health outcomes. Be sure focus on this, again, the social and economic factors as they contribute the most to poor health. Determine most effective strategies, especially those strategies that, if directed towards those in greatest needs, will really reduce health disparities. And finally, do it. Harness the collective power of your community to take action that will create more equitable opportunities for good health for everyone in your community. So now let's see, we have a little bit of time and we have been chatting answers to questions, but we'd also like to answer some of your questions on the web. And I see Kate has some questions that she has and is ready to answer. Go, Kate.
Yep, I'm going to start with this question from Peter. because I promised you all that I would comment on the evidence ratings when I toured What Works for Health, and then I just breezed right over that. So just quickly to return to what those evidence ratings are, we've got 6 different ones: scientifically supported, some evidence, expert opinion, insufficient evidence, mixed evidence, and evidence of ineffectiveness. You can go to What Works for Health on countyhealthrankings.org and find descriptions for all of them. Scientifically supported is what it says. Ratings are most likely to make a difference. Some evidence means we need more information to confirm this, but information strategies are trending in that positive direction. Expert opinion is kind of what it says. We've got limited research documenting effects, but people that are experts in the field think that this is a good idea. Insufficient evidence just really means we don't know yet. We don't have enough information to know one way or the other. It doesn't mean you shouldn't do it. It should mean you should evaluate strongly. Mixed evidence means in some cases it's worked, in some cases it hasn't. So look at your community and look at the places it's worked and see what you think based on your own individual community, what makes the most sense. And evidence of ineffectiveness really means please don't do those. They've been shown not to work. They're not a good investment. So I'm sorry I skipped over that. There's great information though in the What Works for Health section of the website. So go ahead and take a look at those.
This is Mary again, and we have a great question. How can one use the data when presenting to business community regarding the importance of workplace wellness programs? And I think that there are many advice that I would give. One, I think the main point here is that good health is good for business. And if you look at the business guide, which is on the actions, in the roadmaps section at the Action Center, you'll see that guide addresses some specific concerns of business to help you better speak in their terms so that they can and use talking points that are going to better leverage your argument. Also, in terms of what works for health, there are some important programs that have been shown to be effective that you could look up and then share those with the business community.
Okay, great. Thanks, Mary. So we've got a few more questions coming in. We do have a lot of questions. We aren't likely to get to all of them today. We will try to answer the other ones offline, but we've got one on are there ways to address how to motivate individuals to action? We find that events with access to healthy choices, that people don't always take full advantage of these opportunities. Oops, sorry, I muted myself. It's a great question. What we try to think about is how do we create environments where the healthy choice is the easy choice, that we can't just give people information and expect them to change behaviors. We need to make sure that we are putting policies or systems in place or creating an environment where people really feel like they have access to and are able to and have the means to make healthy decisions, and that we are supporting everybody in the community to have those opportunities. So events are absolutely a great way to get people energized and excited and get some momentum going, but really thinking about what in our community are the barriers to people being healthy and how do we change those things to make sure that everybody, regardless of their neighborhood, regardless of their race, have an opportunity to be healthy.
Thanks so much, Kate. And as she said, we will I'm going to change so I have the we will get back to people who have asked questions and we haven't been able to answer. But just to share a few last things before we wrap up here, just want to remind you that please feel free to sign up for other webinars or to check out the archived webinars, I guess I can't talk anymore, archived webinars on the website. And also, you can sign up for our newsletter, for Facebook, or follow us at CH Rankings. Just to use any of our social media to stay connected so you don't miss out on the latest news. We'd like to end with some reflection questions and invite you to consider as you leave the webinar, who else do you need to share this information with? Sometimes we hear these webinars and then, go to the next thing, but just take a moment to think, who else do I maybe need to send the link to this information to get them inspired to want to get engaged in this work? And what is one idea for action that you're taking from this webinar? So lastly, time is up, so we want to sincerely thank you for taking the time to be part of the webinar. Please remember you can click on the Get Help button on our website if you have additional questions, if you're interested in coaching, or if you just want to clarify something from the webinar. So thank you again, and everyone, good day.